Hi, I'm Jen Lee, head of marketing at The Bump. This is Reclaiming Your Power, our series dedicated to highlighting thought leaders and experts who are helping Black families navigate the maternal mortality crisis. I'm so thrilled to be joined by Dr. Tamika Zori, a fertility specialist and OB-gynecologist, as well as Sonia Richards-Ross, a founder and co-owner of Mommy Nation, and last but not least, her partner, Michael Steen, co-owner of Mommy Nation. Thank you so much for joining me.
Thank you.
Thanks for having
us. Of course, Jen. Thanks for having me. I'm super excited to be here. And hi to all the other ladies.
So let's just jump right in. On a scale of 1 to 10, how would you rate your sort of fitness level, healthy lifestyle living? I just want to set the stage and curious, kind of how would you rate yourself?
Right now, I would probably rate myself about a 7.5. So we just came off of our Mommy Nation Fit Mommy Challenge, and that was very, very intense. And we ended it with a 5K run. So we were getting ready for that. And I really did focus and was intentional about making sure I'm creating this healthy lifestyle. And then after the challenge, I've been giving myself a little bit of break. So I still am, working out 3 times a week and having healthy food choices, but I couldn't go out and run a marathon tomorrow if you ask me
to. That's awesome. And Dr. Zori, I'm curious, how would you rate yourself?
It's hard because I was a college athlete. I always attempt to compare myself to back then when part of my job was going to school and being a runner. And that is not my life anymore. And so I think from a physical fitness standpoint, and from where I am in life, I'd say probably an 8. I think I make much smarter diet choices in the sense of in college, you kind of just eat what's there. You eat what you want because I'm going to go run for 3 hours anyways, and you're a college student. But now I think with just making smart meal choices, meal prepping, and being just thoughtful about that and just getting in, goal of 4-ish days of exercise a week. I feel like I'm at an 8 right now. I'm happy. I could do a little bit more, but I feel good that it's maintainable.
If I had to, I guess rate myself on a scale of 1 to 10 right now, for someone who has been at a 10, as an Olympic champion, I would give myself a 4 or 5, regrettably. But yes, that's probably where I am.
Okay. I think these are pretty great scores. I might be talking to some overachievers here, and and that's okay. And there's a reason why I asked that question. Obviously, getting pregnant, being pregnant, and then certainly being a parent of a really young child requires a lot of energy. And I just want to set the stage really to kind of understand the role of sort of health and physical wellness in this whole journey. So Tamika, I'd love to know what impact does kind of the healthiness of your patients play in even getting pregnant or sort of sustaining a healthy pregnancy?
Yeah, I think, we know physical health is important in conceiving. It's important in getting pregnant, staying pregnant, and then even into delivery and complications that can arise. And so I always emphasize for, people trying to conceive, if you can, go to that preconception visit before you're even trying to get pregnant and make sure your health is in order. With your weight, your diet, if you have chronic medical conditions. And that leads us into that, Black women tend to have higher rates of high blood pressure, diabetes, et cetera, compared to white women. And so getting those under control, being on the right medications can just set you up for a more healthy pregnancy, ideally.
Now that's really important. And I think that, sometimes we think about health just in terms of how we look or, how we show up in an Instagram photo, but it certainly has much bigger implications from there. You spoke to a couple of, specific health conditions. Are there any other big risk factors that we should be mindful of if we're faced with and we're also trying to get?
Yeah, I would say, when you're trying to ideally optimize your health when you're trying to conceive, so starting a prenatal vitamin, going through your medications and making sure they're safe in pregnancy. Things like smoking can really reduce fertility. It can increase pregnancy complication rates. It can increase miscarriage rates. And so I'd always recommend don't smoke. I'd recommend avoiding drug use. People always ask questions about caffeine, alcohol. Caffeine in moderation, usually that means less than 2 cups a day, is usually fine. And when you're trying to get pregnant, and even if you are pregnant, and it depends on the type of coffee you're drinking, the type of espresso shots you have in there, but usually a cup or two a day is normal, is totally fine. Alcohol, I'd say pre-pregnancy, when you're trying to get pregnant, moderation, I think is okay. Certainly if that's something that you want to cut out of your life and diet, that's totally fine. Obviously in pregnancy, we'd recommend not having any alcohol because we don't know what a safe limit of alcohol is to potentially reduce or change that risk of fetal alcohol syndrome. So once you're pregnant, we'd recommend avoiding alcohol.
So given that you're all moms and you have, had children, gone through this journey yourself, in addition to playing roles that are really vital in terms of connecting with other moms on this journey, how did you personally work in sort of physical movement when you were pregnant? Did you have any sort of hacks or go-tos?
Oh, that's a great question, Jen. Man, fitness played a huge role in my pregnancy journey. I thought it was extremely important that I continue to stay healthy and stay fit for so many reasons, for myself and for the baby. And I had only been retired for 1 year after becoming pregnant. And so it was still a huge part of my routine. I had missed running so much, and I was trying to find out the new ways that I would stay healthy and stay fit. And to be very honest, I credit my movement, my activity, my focus on wellness and eating well on having an almost perfect pregnancy. I didn't really have any symptoms. I had a great pregnancy. I had a difficult delivery, but I had a really, really, really good pregnancy. And I think that was largely in part because of how much I incorporated health and wellness and fitness into my journey. I became a huge fan of kind of this Pilates kind of yoga mix. I used to do my sun salutations every morning. I did a lot of stretching. Right up until the end, until, you used to kind of get on that bouncy ball and you try to get that baby out of there. But, I think what you should do is what your body is used to. I think that, and I'm not a doctor, but I wouldn't introduce anything too new when you're pregnant, right? It's like my body was used to that kind of rigorous movement and I felt like it responded to that. And so, it's always my goal to inspire women to move and to do things pregnant or not. So when you become pregnant, if that's your desire, your body's already used to that movement and it just feels good and feels natural to you. So for me, it was just doing a little bit of the same stuff, moderated because I wasn't competing anymore. And that felt good to me.
Dr. Zori, what was your experience when you were having your kids?
With my first, I was definitely very much into like running, yoga. I mean, I did a lot of hot yoga when I was pregnant. Unfortunately, as I was getting into my second trimester of pregnancy, I had this pubic symphysis dysfunction where it was incredibly painful to run, even walk. And so running just took a complete backseat. I was able to still do some yoga, but I definitely was not as active as I had hoped I could be in pregnancy. I also gained a lot of water weight, was probably borderline preeclamptic towards the end of pregnancy, and it just made it very difficult to move. And then fast forward to the second pregnancy, that was a much different experience, and was able to really Peloton and exercise, lift weights kind of throughout the entire time. And for me, that's just nice because that's my stress release, moving my body, however it's going to be that day. It may not be for long and it may not be at an intensity of a level 10, but just moving my body just helps clear my head and just resets me.
Yeah, I can't agree enough. So 2 of my 3 kids, I was pregnant with them in New York City. So living in Harlem, walking the blocks to the subway. So I was really lucky in that I couldn't avoid moving and it was super helpful for me. And then my third child who was, born in New Jersey, more suburban lifestyle, that Peloton really did come in handy for me.
It did.
Yeah. So I'd love to shift gears just a little bit. Michael, tell us a little bit about Mommy Nation, why you guys came together and what you built for your community of moms.
Absolutely. So Mommy Nation was created really by Sonia, our founder. It was created to create a safe space for Black moms. It originally started out as just a blog, and we quickly found out that our moms need more than just the resources. The resources are incredible, but they need more than that. They need community and support. And so it is a very vibrant community now where our moms connect in incredible ways. I mean, Sonia and I even became best friends through this platform. There are moms who meet each other for the first time in person, but they've been in this virtual community for, years now, and you would think they were family members. So it's just been an amazing opportunity. We do all of the things. We really try to touch mothers on every part of their motherhood journey, from pre-pregnancy to pregnancy, birth, and then raising the children, which we all know is the toughest part of it all. So we just really want to be there to provide support and advocate for women all over the world. And so that's what we do.
That's really awesome. And I know I'm just getting to know Mommy Nation more, and I love everything that you do. There's
Thank
such
you.
a great purpose for it. And we know it takes a village, and not just, the village to help with the kids, but village to support each other.
Exactly.
So it's really incredible what you do. So I'm curious, you do have moms that come to you, or sort of soon to be parents, or those hoping to have a family. Is the topic of Black maternal health coming up? Is that something that your community members are aware of, talking about, concerned about? What's the conversation there?
Yeah, so obviously as a community that is really intentional about focusing on supporting Black moms, the Black maternal mortality rate is a big issue for us, and something that we do talk about. And, we do have women in our community who, and to be very, very, very honest, Jen, I'm one of those women. I am still not sure I'm done with my family. My husband and I are actively trying to have another child. And I too sometimes have fears about what can happen, when I go into the hospital. And I have a dear friend, a very dear friend, who lost his wife, who was healthy, beautiful. Charles, he's going to be on this platform. Kira Johnson, his wife, Charles Johnson. And, it's a very harsh reality, because the truth is I could be Kira. There's just no ifs, ands, or buts about it, And so, yes, it is always kind of top of mind for our community. It's top of mind for me as a Black mom who has concerns about having a second child. And so we are always trying to figure out how we can do our part in helping to move this along, right? Like it's just mind blowing that we could live in the United States of America and to know that the rate at which Black women are dying are similar to third world countries is unacceptable. And so we know that there's a lot of work that needs to be done. And so, at Mommy Nation, we're trying to figure out what impact we can have. But we're excited to be a part of conversations like this, where we're continuing to, demand change and demand better for women that look like us. Because, the journey of becoming a mom is one of the most beautiful and incredible times in a woman's life. And it shouldn't be scary because of what might happen, when we give birth. So yes, this is a very important topic for us, something that we talk about, we hear about, we experience, and we really want to see a huge difference made in this, on this topic.
That's really awesome that you're there for that support. And even, as the bump, we also have to play the role. It's our imperative, really, to help provide information and make sure that our members are educated. But, it's also a fine line. You want people to have the information, but you don't want to instill or stoke fear. So it's always, how do we center joy, celebrate this amazing transition that our members are going through, but also make sure that people have the right information so they can ask the questions that need to be asked, make sure that they're working with a culturally sensitive healthcare team, and that they feel like they're confident and ready to go about this process and feel like they have everything that they need. So it definitely takes all of us to do what we can to play a role in that process. So, Dr. Tamika, we talked a lot about the role of physical health and how Black women can reclaim their power by staying physically fit, keeping their bodies moving. But I'd like to really address head on the maternal mortality crisis. As a medical professional, what are some ways that our community of Black families can navigate the healthcare system in the face of these really scary statistics?
Yeah, they are. And frankly, being a Black woman who was recently pregnant, I myself was concerned. And even despite me being an OBGYN and fertility specialist, because you just never know if when you think something is going wrong, if someone will hear you and listen to that. And so I think first it's being able to choose a provider that you feel comfortable with, that you know that you can ask questions to, who you don't feel shut down with. For me, that's important for my patients and any patient out there. I think it's making sure you're comfortable with your provider, and then taking initiative with your health. And so that means, again, we have to plan in advance. So if you're thinking about getting pregnant, I always recommend talking to your doctor. If you have chronic medical conditions, get them looked at and let's get them under control before you get pregnant. A lot of times pregnancy can exacerbate things like high blood pressure and diabetes or thyroid disorders. And so we just want to make sure that when you're going into pregnancy, you're doing it in the best way possible. And then also just knowing like the risk factors of, things you may be at higher risk for. Preeclampsia, making sure you understand like the warning signs and symptoms of that, and that you are able to look at that. And if you're concerned about something, that you're going to speak it to your physician. And also, I think just having a plan. If you have any kind of support person there with you, I was very intentional with my second pregnancy of like telling my husband, like, I know these things, but I'm going to be in this vulnerable position where I can't always say what I'm thinking in an adequate way. So I need you to just like be there for me if something's not right. If I'm telling you something's not right, like I need you to run with that and like help me be the voice if I can't, because you're in such a state when you are in labor, when you are, trying to deliver, that you're just, it's so much happening that you can't always have the clearest thoughts or make the best decisions.
Yeah. And that is a really powerful statement coming from you. You are an OB gynecologist, and even that in that moment during labor and delivery, you need other people to support you, to be a part of your support team. And that is such a resonant comment. So thank you for sharing that.
I was exhausted in labor. I was so tired that it's hard to like just think clearly and be in the moment of what's all going on.
100%. And there's no two labors that are the same. Yeah. And you just, have to expect the unexpected.
Yep.
But have that plan and have that layer of support. That is a really good safeguard. Yep. Dr. Tamika, I do want to ask another question that is somewhat controversial. In our culture of social media, there's, all these notions around getting snatched and bounce back and all of these things tied to how women think about their own body image, not only pre, but certainly post-pregnancy. Are these conversations that you're having with your patients, where people are concerned about gaining too much weight, and how do you manage those conversations?
The conversations around weight and trying to get pregnant while you're pregnant and then postpartum are big questions and thoughts for probably anyone who is looking to conceive. It was something I struggled with, because we live in this culture with the social media of like, oh, she lost all this weight post baby. Look at this 9 months in, 9 months out photo. And really, like it literally took your body 9 months to create a human. Your body is completely different than before you had a child, or child number 2 or 3, or however many you've had. And I think we have to remember, and I tell myself this all the time, I'm telling it to myself, that you have to be kind to your body. It did a lot. It grew a human. It birthed a human. And to expect yourself to bounce back 6 weeks or 12 weeks or even 9 months later is extremely unrealistic. And it's not fair that society has put that kind of pressure on women giving birth, or people giving birth. And so I think the conversation about weight is certainly that, yes, it can impact certain success rates. It can certainly change complication rates in pregnancy. But I think it's more about just maintaining a healthy weight for you. That doesn't mean being underweight. It doesn't mean being a stick figure. But it means you will gain weight in pregnancy. And it's about getting a healthy amount of weight to support yourself and the child that you're carrying. And so that conversation with weight is just making good diet choices. It's not saying if you're perfect, but just eating like a relatively healthy diet and balancing that with like eating also what you want and what you need, and physical fitness and doing what you can. It doesn't mean you have to run a marathon. But maybe it means you take the stairs one day. Maybe you park further back in the parking lot and you walk a little further in. I know that's always a question as people are like trying to get pregnant of, should I exercise? Do I stop? Should I do it in pregnancy? And And really it is, yes, it's always individual. I always say talk to your doctor about that. But overall, it's great to move your body. Um, and that same conversation around weight is, yeah, there are increased risks of miscarriage when you're overweight or when you have a BMI over 30. There's higher risks of pregnancy complications, potentially higher risk of C-section. And so it's more just about trying to stay healthy, maintaining your weight, and just being active.
I think that's really key to share with the audience. And in addition to the benefits of like endurance that come from, continuing to move your body, also the release of endorphins. I know I just feel better when I work out and when I move. So, and sometimes just as a stress reliever, because emotionally there's also a lot going on during this process. And certainly, soon after baby arrives and you're readjusting to what your new life looks like. So. Those walks with the baby were key for me in those first couple weeks in that fourth trimester.
Yep. Getting out of the house.
Yeah, indeed. I'd love to close out with just any encouraging words or advice that you have for soon-to-be parents. What would you tell someone who's about to transition into parenthood, and how can they sort of feel confident and excited about what's to come next?
I have done a lot of things, and I've accomplished a lot of things, but becoming a mother is by far the most rewarding and beautiful journey of my life. There's nothing like seeing this little human being that you love so much, that you pour so much into, grow up. And even though it's only been 5 years for me, just the other night, I looked at my son and I'm like, this is incredible. This is incredible. And so, for all the soon-to-be mommies out there, it is okay to feel like you're not ready, to feel like you're never going to be ready. I waited a long time to become a mom, and you may never feel like you're ready. But then one day you have this baby and you realize you are enough. You're exactly what they need, and you are more than ready. And it's a ride of a lifetime, to be a mom, and it's a beautiful, beautiful experience, and I would never trade it for the world. So, but I will say, find your tribe, lean on your mommy friends, give yourself grace, and have fun. Because it's not going to be easy, but I think the best things in life aren't. The best things in life take a lot of work and, challenge us to be greater. But motherhood is the best hood, and I can't wait for you to join us.
So the piece of advice I always give moms is get a community. Be surrounded around women who have gone through this experience, because sometimes the person next to you may have a different experience from you, but if you have a group of women, a tribe around you, there's going to be somebody that you can relate to. So I always say, get you a tribe, get you a community. We say at Mommy Nation that it takes a village to raise a child and a nation to support a mommy. And we really, really believe that. So get you a tribe. And the piece of advice I would say is that order a lot of wine, because sometimes, there's nothing that you really can do. You just really have to wing it. Like, we're all out here doing the very best that we can. So your very best is good enough.
Thank you so much for joining us for Reclaiming Your Power. Please continue to follow The Bump and visit the Black Maternal Health Hub for more helpful resources.